Good afternoon, everyone. I'm Dr. Sneha. I'm here to present a paper on Smile Pro Unveiled, initial outcomes with VisuMax 800 from 1500 eyes. I have no financial interest. The chief author is a consultant for Zeiss. So Smile has demonstrated safe and effective results for myopic astigmatism correction over the past 13 years worldwide. VisuMax 500 was European conformity and US FDA approved for myopia ranging from -1 to -10 diopters and myopic astigmatism ranging from -0.75 to -3 diopters with a maximum spherical equivalent of -10 diopters. In September 2021, the VisuMax 800 was launched. It is a second generation femtosecond laser for Relax Smile Pro. It comes with significant upgrades to the existing platform. It has swiveling laser and microscope arms, and it has a higher pulse frequency of 2 megahertz in comparison to the 500 kilohertz of VisuMax 500. This drastically reduces the lenticule creation time from 30 seconds to less than 10 seconds. It also integrates the automatic centration known as central line and the cyclotorsion known as oculine. The purpose of this study is to evaluate the visual and refractive outcomes of Smile Pro in a cohort of 1500 eyes treated with VisuMax 800. This was a retrospective single-center study of 1500 eyes treated with Smile Pro by a single experienced surgeon at Netradama Super Speciality Eye Hospital, Bangalore. The inclusion criteria were aged between 21 to 45 years of age with a CDVA of 20/20 or better, with pre-op myopia ranging from -1 to -10 diopters and astigmatism ranging from -0.5 to -4 diopters with a total spherical equivalent of -10 diopters. Patients with severe dry eyes, corneal pathologies, cataract, glaucoma, retinal pathologies, other ocular disorders, and patients who were on immunosuppressants and pregnant individuals are excluded from the study. All patients who underwent they underwent a complete ophthalmic assessment preoperatively, and the manifest refraction was repeated on the day of the procedure. Follow-ups were on post-op day 1, 2 weeks, and 3 months. So 98% of the patients had a UDVA of 20/20 or better, giving us an efficacy index of 1.01. 18.4% of the patients had a gain of 1 line of CDVA, whereas 72.4% had no change. 9.2% had loss of 1 line of CDVA. Out of this, 78.9% of them still had a CDVA of 20/20 or better, and no eyes lost more than 2 or more lines. 99% of the patients had a spherical equivalent within plus or minus 0.5, and 100% were within plus or minus 1 diopter, giving good accuracy. The mean change in the spherical equivalent at 3 months was 0.016, which gives good refractive stability. Astigmatism, 98.5% of the patients had less than 0.5 diopters, and 100% were less than 1 diopter. The OSI, average pre-op OSI was 0.73, and post-operatively it was 0.84. We had a 12-month follow-up of 386 eyes. The rest were lost to follow-up. This shows that the UDVA was 95%. In 95% of the patients was better than 20/20. And 87.8% had UDVA same or better than CDVA, and 98.7% had UDVA within 1 line of CDVA. 5% had a gain of 2 or more lines, 36% had a gain of 1 line, and 51% had no change, giving us a safety index of 1.06. The spherical equivalent refraction accuracy shows that 99.2% were within plus or minus 1 diopter, and the 2.7% had a change of more than 0.5 diopter in the pre-op refractive stability as compared to the pre-op, and refractive astigmatism was 100% in less than 1 diopter. So our study showed that 98% of the eyes had a UDVA of 20/20 or better, and 99% had a spherical equivalent within plus or minus 0.5 diopters at 3 months. Other studies with a smaller cohort by Reinstein et al. And Sard et al. Showed 91% and 93% of eyes within 20/20 UDVA, and 86% and 91% with a spherical equivalent plus or minus 0.5 diopters at 3 months. This could be because of the laser optimization at our center. 18.4% showed a gain, and 9.2% reported loss of 1 line in 3 months. This was comparable to Reinstein et al. Showing gain of 1 line in 15% and loss of 1 line in 8%. 98.4% had a residual astigmatism of less than 0.5 diopters. This is attributed to the oculine software. Safety index was 1.6 and efficacy index was 1.01, which is an improvement from the VisuMax 500. The study which showed safety index of 1.11 and efficacy index of 1.06 at our institution, and another study by Musharraf et al. Showed a safety index of 1.12 and efficacy index of 0.95 with the Visumax 500. Mean change in OSI of 0.11 was seen at 3 months. Suction loss rate was 0.06%, that is 1 eye, compared to the 0.5% in Visumax 500. This shows an 88% reduction in the suction loss rate. The only limitation was a 3-month follow-up, but previous research has indicated that the refractive stability is typically achieved within this time frame. So due to the large sample size, it's safe to assume that the outcomes observed are more reliable and statistically sound. To conclude, Visumax 800 is safe and effective in treating compound myopic astigmatism with robust results, including excellent visual outcomes and refractive stability. Thank you.
So good amount of patients you have, and your results are very good. So what was the upper limit of astigmatism that you
4
went?
diopters, ma'am.
Thank you.
Thank you, ma'am.